acupuncture help improve the function of different organs, adrenal gland, thyroid gland, ovaries, different kind of endocrine organs. So you have balanced hormones. So you don't have estrogen dominance condition or low testosterone. You build stronger muscle, you increase your metabolism. So we talk about how acupuncture help back pain, knee pain, or dropping foot. Now for shoulder pain, you can do the local point. You can also do the hand point. For the local point, say for the shoulder joint, the large intestine 15, triple wormer 14, and jianzhong, that's the area where you have muscle tightness or you have joint swelling inside. And to do acupuncture to help reduce the swelling inside, we can do local point, but also we can do the point here called large intestine 11. This point we can do the acupressure. So I'm going to put needles there, and then you will know how to locate this point. So if we can bend our elbow like this, you'll see the crease in the elbow, and at the end of this crease, that's the large intestine 11. So you can press that point, and that's one point we can use to help reduce the swelling in the shoulder joint and just general inflammation. Not only that, because it's connected with our digestive system, large intestine 11 can also help the digestive issue, leaky gut, Crohn, or constipation, IBS. So with this point, we can locate helping the arm pain, shoulder pain, but inside it helps the digestive issue. Not only that, it clears up general inflammation. So when the inflammation going down, then any kind of pain, shoulder, here, or the hand, I'll show this lady, she has the shoulder pain for how many years?
About 5.
5 years. And did you ever have the surgery?
No.
So the surgery will cut open and saying that clear up the inflammation inside, unless you have no other choices. But she chose the acupuncture. And is this tender here?
Yeah.
Or it's more here?
First place.
The first place. So this point will have some kind of inflammation, muscle tightness, swelling inside. So this is the 2 spot we're gonna needle and relieve the tension here to clear up inflammatory chemicals in this area. And then after acupuncture, when she lift up her arms, the pain is a little bit better, right?
Yes.
Yeah. So did you ever have cortisone shot for the shoulder pain? Once. And how long it had been?
Since I got the cortisone shot?
Yes.
About 5 years.
5 years. And you haven't had one for the past couple of years, right?
No, not since the acupuncture, no.
Yes. So this lady, she is a strong believer of acupuncture. So we do the needles like once a week or every other week to keep all the muscle in a balanced state. When the muscle is very tight, not only you won't get good circulation, so the inflammation can get worse, but also when you use this joint with a tight muscle, you can easily tear your ligaments around the shoulder joint. And once you get ligaments tear, and then that take longer time to heal because the ligaments has not so many blood flow there, but I think for this lady, you don't have any ligament here, right?
No.
Yeah, I think it's more muscle issue and joint arthritis.
Right.
So she used to eat a lot of, when she worked for the insurance company, she worked so hard and she didn't eat very healthy. But then now you quit coffee, right?
Yes.
And she started drinking green tea, so the muscle is not as tight. So this two spot will helping the shoulder pain to prevent future ligaments tear. Now, this lady also has arthritis in her hand, and you had a surgery for your wrist, right?
No, it's the left thumb.
The left thumb.
I had the, it was the trapezium bone was removed.
So the trapezium bone, so the cut is here, right?
Right.
Yeah, but usually hand surgery is a very complicated surgery. So after that, most people will develop severe pain. But because this lady changing her diet, drinking green tea, eating healthy food, and the pain is mainly on this joint, right?
Yes.
And the surgery area has no pain now.
No.
Yeah. So before she has hard time to grab things, right?
Yeah, I couldn't turn the doorknobs or anything.
Yes. After surgery, she can continue work in a computer. But this thumb, if you look at her thumb, the joint is swollen and a little bit deformed. And so she has tender spot here.
Mm-hmm.
And initially, she really didn't think acupuncture could help that. But we tried once when we treated her shoulder, and she feel much better, right?
Yep.
Yeah. And it is a little bit sensitive spot. So I try to choose this point, large intestine 4, to help the whole energy move to here. But locally, I have one spot. If you turn like this way, and you see this thumb joint is kind of a little swollen, and this is a very sensitive spot.
Yeah.
So we only put one here. What we could do is to avoid another spot here. We could do here on around the wrist line. If you turn your thumb up, then you see two ligaments here. Like here, you see two ligaments here. In between these two ligaments, there is a point here. There's an acupuncture point, and actually she has a scar tissue. So between these two ligaments, we can do, that's another point. Take a deep breath in, and yes, now you can relax. Yeah. So we have large intestine 4, large intestine 5, and a local point on this thumb joint. So now we gotta reduce the swelling in this joint, and also we got the large intestine 4, 5 to help the energy flow. Remember large intestine 4, when you put your finger together and you have the highest point between your index finger and your thumb, and the highest point is this large intestine 4. So that one, not only for the hand pain, for headache, also just generally for the pain all over the body. So you can relax this hand. So large intestine 4, you can use that to do the acupressure. Large intestine 11 could do the acupressure point. And you see we have large intestine 5, which is here, we just showed, between the two ligaments on the wrist line, between the two ligaments, and there is an indentation here. I can actually put the needles here so everybody will see that. So so this is one ligament, and this is another ligament on the wrist line. So if we put needle here, and this is large intestine 5. And so on this lady's wrist, So this is large intestine 5, and we have large intestine 11. You draw a line, and on this line, you put your 3 finger down to large intestine 11, and that's the large intestine 10, which is a very good point. If I press that, you feel pressure, right?
Yes.
You feel pressure, soreness,
Mm-hmm.
and this one is very good to helping the digestion and immune system. When people have autoimmune disease, they have internal heat. They don't digest well, so undigested food, especially undigested protein, will cause hyperactive immune system. And doing those large intestine 11, 10, 5, 4, that whole set of large intestine point will rebalance your immune system, so it will not become too active to produce antibody attacking your gut, Crohn's, IBS, or attacking the joint, arthritis. So when you lie down doing acupressure point, we showed you certain point on the foot, but this 11, 10, 5, and 4 is so easy on this side. So you can alternate the left side, alternate to right side, and take deep breath in. But the most important thing, when you do those acupressure point, meditation, you need to lie down. Traditionally, people think meditation you have to sit there. But in modern society, we sit too much. We don't lie down enough time. So once you lie down, you instantaneously relax your back muscle, bring the blood flow to your heart, to your eyes, and in that way, you can meditate and balance the muscle, the back, and relax the eye muscle. Not only that, when you do the acupressure point, you can bring down your blood pressure. If you sit up there, your blood flow to your eyes, to your brain will be reduced. So you can actually have eye problems if you do acupressure sitting position for a long time. So lying down for 20 minutes once a day or twice a day is going to save you so many trips to hospitals or even to me, the acupuncturist. Thank you. If you tried other methods and you still have health issues, you should try acupuncture to see how it works, and combining the herbs, you can save money and time, be healthier and happier in 2024.